let's start with what do the numbers show us where people think how many people are going to be dead? What people think this is actually going to look like, and then let's compare them to what the experts are predicting.
Yeah, I'd love to.
So I'm looking for the average person.
Yeah, love to get your thoughts on this, Pat, too, because it's Pat Gray joins us from Pat Gray Unleashed. It's one of these things where this has moved really fast, right? Like you look at this is March 11th. Okay, that's in March, 3 weeks ago.
Mm-hmm.
So they asked if you had to guess how many people do you think will die in the United States because of coronavirus over the next year? Okay. 18% of people said less than 100 people. This is
less than 100?
Less than 100.
Oh, wow.
Okay, this is as of March 11th. More than
3 weeks ago?
Yeah, 3 weeks ago. More than 100,
Holy
but less
cow.
than 1,000, okay, was 37%. So half of the people in the United States believed less than 1,000 deaths. I'll remind you, we're at 4,000 now, okay? So we've obviously exceeded that by quite a bit in the 3 weeks. More than 1,000, but less than 10,000. Okay, that was another 32%. So you're at 87% of people who believed it was going to be less than 10,000. There's almost no chance it's going to be less than 10,000. We should hit 10,000 next week with this, the way it's going right now.
I bet we hit it earlier than that. Don't you think?
Maybe I would think
we're doubling.
Yeah, we did almost 1,000 deaths yesterday.
Days.
Almost 1,000 deaths yesterday. Yesterday was the second highest total of any country during the entire coronavirus scare, with the exception, I mean, you can't count China, which is obviously lying about their numbers. I would expect they probably had bigger days than this. But there was one day in Italy that was higher than our yesterday. So, I mean, like, it is, it is.
And we're not even at the peak yet.
No, as Trump talked about yesterday, they believe the peak's going to be in a couple weeks, where it could be multiple thousands per day. And only 12% of the people, only 12% believed it would be over 10,000 dead in the next year. They redid the exact same poll in March 26th, and it's revealing that the poll on March 11th, the highest answer you could give was over 10,000. So they didn't even have a category above that. They had to add that when they asked the poll again. So they asked again, which this is just at some point humorous. Less than 100, 5% still thought it would be less than 100. Now, at this point, we were
even though it was way beyond that.
Past 100 already. Another 19% thought it would be less than 1,000. And again, we were past
beyond that.
1,000 as well on March 26th. 46% still believed it would stay below 10,000. Again, I don't think that's going to happen. And 31% said it would be more than 10,000 dead in the next year. So they broke out that category and said, okay, if you believe it's more, if you're in that 31%, you believe it's more than 10,000, what do you think it will be? Will it be more than or less than 100,000? A third of people believed that. So about 10% of the total populace. About 15% of the total populace believed between 100,000 and 1 million, and the rest was more than 1 million. So again, I don't think it's going to get that high, but still, that is you realize how fast this comes. We were at a point where half the country was like, less than 1,000 deaths 3 weeks ago, and now we're at 4,000. And a lot of times I think this moves just at the pace where it doesn't seem shocking to you on a day-to-day basis, but when you look at it over a multiple week basis, you're like, holy crap, this is moving quickly. So it is scary.
So what are the real, because first of all, I think we're going to hit between 100,000 and 1 million. I think 1 million is a long shot, but I think we hit between 100,000 and 1 million.
Yeah, 1 million would be.
What a year.
No model predicts 1 million unless we do nothing.
Yeah.
Like they all,
right.
There are a lot of models that will say that if we basically just kind of go free for all and no good news comes, there's no treatment that pops up or anything like that.
Pat, what's your number? Less than 100?
100,000 or 100 people?
No, 100,000.
I think around 100,000.
Okay,
that's still a lot.
Yeah, that's a lot.
That's a lot.
That's a lot.
Now
That's
Fauci says between 100 and 240,000.
Yeah, and that's based on the Imperial College model, which is the one that also predicted up to 2.2 million if we did nothing.
Yeah.
So
what is the Seattle model? What is the one that's coming out of Washington State?
Yeah, University of Washington has one that I think has been more reserved and also updates every day, unlike the Imperial College model, which they did. This one I think is interesting. They predict the total death count to be 93,765. Now, it's interesting because they update it every day with new information. Yesterday, they were predicting 83,000. So in one day, they've upped it by 10,000, which I would say is not a good sign.
No.
Now, that's their best guess. The high end and low end is about 40,000 to about 175, I would say, is their estimate. And that's an interesting one because they really do go and give state by state estimates as to when they think the peak of each state will hit. I'll tweet this out at Stu Does America if you want to kind of go through it and nerd out on the data as well. But at least kind of gives us a sense. And this is why you see Trump, dead serious yesterday, talking about, hey, the next couple of weeks are going to be awful. Prepare yourself for it mentally. And of course, obviously, physically by not,
So when is
parties.
the peak? Our governor yesterday here in Texas came out and said schools are not going to return until May. We're closing everything down until May. And what is it, May 15th? Do you guys know? I mean, when is it supposed to hit and peak in Texas? Because it's not really. I mean, it's here. A couple of people in my town. We have a small town of about 900 people. There's 2 people that I heard of just last weekend, so there's got to be more now. But 2 in my town that have it. When is it supposed to peak here?
In early May, according to the models, according to this University of Washington model. May 7th would be a Texas peak.
It's interesting to note that Washington seems to be on the decline already.
Mm-hmm.
They went through a really bad time, and it looked like they were going to be the state that was out of control, but New York took that from them, and so did New Jersey. But their numbers are actually starting to decline now.
Yeah.
So
And
that's
how
a good
about California? Yeah, it is. How's California?
California, you're saying what peak date for California?
Yeah, what peak? And I'd like to know Chicago, too. I mean, we haven't heard much about Chicago.
Yeah, well, first of all, Chicago, actually not a state. It's a city.
In
the United States.
Illinois, sorry.
No,
I know.
April 29th for California would be, or actually, it looks like May 2nd maybe is the California peak. Again, these are all approximations. They change every day.
Yeah.
Give you an idea. Illinois is a little earlier than that, April 20th. But you could see like there's massive still bars of error here. And as Dr. Fauci talked about yesterday, Trump has echoed this as well. We hope to do a lot better than this, right? This is with all of the social distancing stuff that we're doing. This does not include if we all kind of give up on it. If we give up on it, all their numbers get uglier, whether you believe
Well, if
it or
we
not,
give
who
up on
knows?
it now, I mean, we've already done the damage, man. Let's not pull out of this thing too early. You know what I mean? I think that there's a chance that we come roaring back with all the pent up everything. There's a chance that we just come roaring back because we'll want to go out and do things. We'll want to go out and shop and spend money and go to restaurants. So, as soon as this thing comes back, if there is a clear kind of cut ending to it, it will really help the economy.
And there are some positive things that are there. For instance, there's a new study by the medical journal, The Lancet, Infectious Diseases, which I usually wait for the swimsuit edition, but I got this a little bit early. Yeah.
Really?
The
Okay,
Lancet
good. Wow.
Infectious Diseases swimsuit edition is unreal.
Unbelievable.
You've
too
got to
explicit,
see it.
too hot for
When they
stores.
did the swimsuit edition on leprosy,
Right? Remember that?
Gosh,
Oh
it was
my.
good.
It was-
Leopard
It
print
was
and
on
leprosy.
fire.
Yeah,
But
Yeah,
they
it was great.
They've done a study and they found the mortality rates have been overstated, is what they're saying. They said that the mortality rate right now looks like it's going to wind up to be about 0.66%.
Yeah.
Which is
Oh,
really
did you-
promising.
Oh, wait. Did you hear CNN talk about this?
Oh, no.
CNN reported on this.
Yeah.
And CNN, they did all kinds of stuff about how the mortality rate is too high and it's going to come in way under 1%, blah, blah, blah. See, was I the only one that was screaming, going, wait a minute. You guys were just saying that the president, how dare the president say that when he came out and said it will be under 1%.
I did a whole show on that stupid, because they were all bashing him at the same time as when the World Health Organization announced it was 3.4% worldwide. But every expert was aligned, saying it was not going to be 3.4%.
It was at the most about
one.
1% is where they thought it would wind up.
So 0.66 is great. I think there's a good chance it gets even lower than that when it comes to the end of this. I think there's a chance that even that's high.
I got to give you this last story too. I mean, you just want to talk about the press, and I mean, watch tonight's show. It's just agonizing. Try this one on. Here's the New York Times. This is from Monday. New York Times headline: More Americans probably should wear masks for protection. Oh, God. They were just telling us, we told you. No, why would they be saying they need them for the hospital if they do no good? Of course you should be wearing a mask. They're trying to make sure that they have enough for the hospitals. Instead of saying that, they just kept saying they're no good. People won't, it's not effective at all. Now they're coming out and telling you, you know what, maybe you should wear masks.
That's unbelievable.
Of course, we all should have been wearing masks.
That's unbelievable. That's disgraceful, though. You can say, I think the American people would say, look, we're not going to hoard masks. We of course want the health workers to have them first. But I mean, to tell us that they're not effective and then say that they are just a little bit later on is disgraceful. You can't do that.
Well, to say they're not effective at the same time you're saying we need them for the hospitals. Hello? Gosh, they just think we're just idiots. Just idiots.